You bought a softer toothbrush. You started flossing every single night. You even switched to that gentle toothpaste the commercials promised would fix everything. And this morning, when you rinsed and spit, there it was again. That faint pink swirl in the sink. So you did what most women do? You blamed yourself. You brushed too hard. You skipped flossing that one weekend. You need a new toothbrush. Again. But here's what almost no one tells women over 40. If your gums started bleeding, or bleeding more, in your 40s, your toothbrush may have nothing to do with it. The real trigger might be circulating through your bloodstream right now. It's hormonal. It's measurable. It has a name in the dental literature. And by the end of this video, you'll understand exactly why your gums are responding this way, how to tell the difference between ordinary gum inflammation and hormone-driven gum inflammation, and what you can actually do about it starting today. Before we begin, this video is for educational purposes only and is not medical or dental advice. Always consult your dentist or physician about your personal health. Let's talk about what this actually feels like. Because bleeding gums are never just bleeding gums. It starts small. A trace of pink when you brush. You ignore it. Everyone's gums bleed sometimes, right? Then it happens when you floss. Then it happens when you bite into an apple. Then one day you notice your gums look different. Puffier, redder, more sensitive. Maybe they've started pulling away slightly from your teeth. Maybe your breath has changed, and no amount of mouthwash seems to fix it. And so begins the cycle that millions of women know by heart. You buy the softer brush, you buy the water flosser, you book the cleaning. The hygienist raises an eyebrow and tells you to improve your home care. As if you haven't been trying, you leave the office feeling vaguely ashamed, like you failed a test you didn't know you were taking. Here's the part that stings. Many of these women have better oral hygiene than they've ever had in their lives. They're doing everything right, and their gums are getting worse anyway. If that's you, you are not imagining it. And you are not failing. Something else changed. And it wasn't your brushing technique. Picture a woman in her mid-40s. Call her the woman in the mirror, because she could be almost anyone. Her periods have become unpredictable. Some months heavy, some months barely there, some months skipped entirely. Her sleep is broken. She's warmer at night than she used to be. Her dentist has been the same for 15 years, and for 15 years her checkups were boring. In the best possible way? Quick cleaning, see you in 6 months, done. Then, sometime around 44, 45, her checkups stop being boring. Bleeding on probing, inflammation, gingivitis, the dentist says, and hands her the same advice she's heard since childhood. Brush better, floss more. But she is brushing, she is flossing. What nobody in that room connects, not her, and often not her dental team, and is the timing. The gum changes arrived on the exact same schedule as the irregular cycles, the night sweats, the brain fog. That's not a coincidence, that's a pattern. And it has been documented in dental research for decades. Because here's the piece of the puzzle most women are never given. Your gums are not neutral bystanders in your hormonal life. Gum tissue is what researchers call a target tissue for sex hormones, meaning it doesn't just tolerate your hormones, it actively responds to them. Your gums have been listening to your estrogen levels since puberty. They listened during pregnancy. And they are listening now, during perimenopause, when those levels stop being a steady signal and start becoming static. The woman in the mirror doesn't have a hygiene problem. She has a hormone transition showing up in one of the few places she can actually see it: her mouth. So let's open up the research and look at what's actually happening. Because this is where it gets genuinely fascinating. First, your gums have hormone receptors. This isn't a theory. Researchers identified estrogen receptors in gingival tissue decades ago. A major review by Dr. Angelo Mariotti, published in Critical Reviews in Oral Biology and Medicine, laid out how sex steroid hormones directly influence the cells of the periodontium, the gums, the ligaments, and the bone that hold your teeth in place. Estrogen affects how gum cells grow, how they repair themselves, how blood flows through the tissue, and how the tissue responds to irritation. Which means that when your estrogen changes, your gums change. Not metaphorically, cellularly. Second, perimenopause isn't a smooth decline. It's a storm. Most people imagine menopause as a slow, steady drop in hormones. But perimenopause, the 5 to 10 years before your final period, is nothing like that. Estradiol levels during this phase swing wildly, sometimes spiking higher than they were in your 30s, then crashing weeks later. Endocrinologists studying the menopausal transition, including work from the landmark SWAN study, the study of women's health across the nation, have documented just how erratic these fluctuations are. And your gum tissue, with its estrogen receptors, rides every one of those waves. That's part of why symptoms can seem to come and go. 2 good months, then a flare. It tracks the hormonal chaos underneath. Third, lower estrogen changes how your gums handle inflammation. This is the core mechanism, so stay with this for a moment. Every mouth contains bacteria. When bacteria accumulate along the gum line, the immune system responds with inflammation. That's normal. But estrogen acts as a moderator of that inflammatory response. Research published in journals like the Journal of Periodontology has shown that estrogen helps regulate inflammatory messengers. Molecules with names like interleukin-1, interleukin-6, and TNF-alpha. When estrogen is steady and sufficient, the inflammatory response to a small amount of plaque stays proportional. Small irritant, small response. But when estrogen becomes erratic or drops, that moderation weakens. The same tiny amount of plaque that your gum shrugged off at 35 can now trigger an exaggerated, amplified inflammatory reaction at 45. More swelling, more redness, more bleeding. Read that again. The same amount of plaque. Your hygiene didn't get worse. Your gums tolerance changed. Dentistry even has a name for the gum changes seen around this transition: menopausal gingivitis, a condition described in the periodontal literature where gum tissue becomes dry, shiny, abnormally red or pale, and bleeds easily. Fourth, estrogen decline affects the tissue itself. Beyond inflammation, falling estrogen is associated with thinning of the gum's surface layer, the epithelium, and reduced keratinization, which is the protective toughening of the tissue. Thinner, more fragile tissue simply bleeds more easily under normal brushing pressure. Blood flow to the gingiva also shifts with hormonal status, so the tissue is more fragile and more inflamed at the same time. That's the double hit. Fifth, it doesn't stop at the gums. It reaches the bone. Estrogen is one of the great guardians of bone density, and that includes the alveolar bone, the ridge of bone that anchors your teeth. Studies in the Journal of Periodontology, including research by Reinhardt and colleagues comparing postmenopausal women with different estrogen levels, found that women with lower estrogen showed more gum inflammation and greater attachment loss. The slow detachment of gum and bone from the tooth. This is why bleeding gums in perimenopause deserve attention rather than dismissal. Untreated gum inflammation can progress toward periodontitis, and according to data from the CDC, nearly half of adults over 30 already have some form of periodontal disease, with the risk climbing with age. Perimenopause sits right at the intersection of those risk curves. And one more piece, saliva. Estrogen also influences salivary flow. Many women in perimenopause experience drier mouth, especially at night. Saliva is your mouth's built-in defense system. It washes away bacteria, neutralizes acids, and delivers minerals to your teeth. Less saliva means bacteria linger longer along the gum line, feeding the very inflammation your gums are already overreacting to. So connect the whole chain: fluctuating estrogen, then an exaggerated inflammatory response, then more fragile tissue, then less protective saliva. And underneath it all, bone that's losing its guardian. That is why your gums are bleeding, not your toothbrush. Now, an important question: how can you tell whether bleeding gums are ordinary, plaque-driven gingivitis or part of your hormonal transition? A few patterns are worth noticing. Timing. Did the bleeding begin, or clearly worsen, in your 40s, alongside other changes like irregular cycles, night sweats, disrupted sleep, or brain fog? Hormone-influenced gum changes tend to arrive as part of a cluster. Effort versus result. If your oral hygiene is genuinely consistent, brushing twice daily, cleaning between your teeth, and your gums are still inflamed, that mismatch is a signal worth discussing with a professional. Fluctuation. Hormone-related gum symptoms often wax and wane, sometimes tracking your cycle while you still have one. Classic plaque gingivitis tends to be more constant. Other oral symptoms: dry mouth, burning sensations on the tongue or gums, altered taste. These frequently travel together with hormonal gum changes, and they're described in the same body of menopausal oral health research. None of these patterns replace a professional exam, but recognizing them changes the conversation you have in the dental chair. From brush better to let's look at the whole picture. So, what do you actually do? Here's a practical, evidence-aligned plan. Step 1. Get examined. And say the word perimenopause out loud. Book a dental checkup and tell your dentist or hygienist where you are hormonally. This single sentence changes how a good clinician interprets your gums. Bleeding on probing in a 46-year-old woman with irregular cycles is a different clinical story than the same finding in a 25-year-old. Your dental team can't connect dots they don't know exist. Step 2. Don't back off your hygiene. Refine it. Here's the trap. When gums bleed, many women instinctively brush less or avoid the bleeding areas. That's the worst possible move because plaque left behind fuels more inflammation. Instead, keep cleaning thoroughly but gently. A soft bristled brush, small circular motions angled toward the gum line, and daily cleaning between the teeth. Bleeding during gentle, proper cleaning is a sign of existing inflammation, not a sign to stop. Step 3. Consider shorter professional cleaning intervals. During the menopausal transition, many clinicians recommend professional cleanings more often than the traditional 6 months, every 3 to 4 months for women showing gum changes. Since your tissue now overreacts to small amounts of plaque, keeping that plaque professionally controlled matters more than it did a decade ago. Step 4. Support your saliva. Hydrate consistently through the day. Chew sugar-free gum, ideally with xylitol, to stimulate flow. If night dryness is an issue, avoid alcohol-based mouthwashes, which dry the tissue further, and ask about saliva substitutes or moisturizing gels. Step 5. Feed the tissue. Vitamin C is essential for collagen, the structural protein of gum tissue, and vitamin C deficiency shows up in gums quickly. Omega-3 fatty acids have been studied for their role in modulating inflammation, including in periodontal research. A diet built around colorful vegetables, fatty fish, and minimal added sugar supports your gums from the inside. Sugar, meanwhile, feeds exactly the bacteria you're trying to control. Step 6. Bring your physician into the loop. If bleeding gums are arriving alongside a broader wave of perimenopausal symptoms, that full picture belongs in a conversation with your doctor. Interestingly, some periodontal studies have observed that postmenopausal women receiving hormone therapy showed less gum inflammation than women with low estrogen who weren't. Not a reason to make any decision on your own, but a powerful illustration of how deeply connected your hormones and your gums really are. Whether any therapy is right for you is a personal medical decision that only you and your physician can make together. So let's return to that pink swirl in the sink. For years, you were told it meant you were doing something wrong. Brush better, floss more, try harder. But now you know the deeper story. Your gums are hormone-responsive tissue, riding the most turbulent endocrine transition of your adult life. The bleeding isn't a verdict on your habits. It's information. Your body posting a message in one of the few places you can actually see it every single day. And information is power, because gum inflammation caught early and understood correctly is manageable. The women who struggle most are the ones who spend years blaming their toothbrush while the real cause goes unaddressed. Your mouth has been telling the truth all along. Now you know how to listen. If this video connected dots that no one connected for you before, share it with a woman in her 40s who's still blaming her toothbrush. And subscribe, because on this channel we explore what midlife is really doing to your body, one hidden connection at a time.